Board. All right, so we are recording again. Welcome to our presentation on neuropathy. It is my pleasure to introduce Brenda Crowley. She works with Specialty Rehab as an occupational therapy assistant who gives treatments to individuals. She is also their Director of Business and Program Development. So Brenda, without further ado, I will turn it over to you.
Good morning, everybody, and thank you for coming to this presentation. I'm assuming that some of you are either patients yourselves, survivors yourself, or you are caregivers. And we're going to talk today about chemotherapy-induced peripheral neuropathy in survivorship. I'm going to refer to it as CIPN, which you may have heard before. This chemotherapy-induced peripheral neuropathy is a mouthful. So we're going to proceed. So what can you expect to learn today from this little presentation? You're going to learn a little bit about what causes CIPN. You'll be able to recognize the signs and symptoms. You will learn how it may impact your function. And we're going to give you some evidence-based strategies that you can take away from today and begin to use. And we're going to keep you safe. So what is CIPN? It's the second most common effect of chemotherapy. It results in an inflammation or injury or degeneration of the peripheral nerves. So what exactly does that mean? We have nerve endings that run all over our body. The ones that are impacted with chemotherapy are the ones at the ends of our fingertips and our toes. And the result of the chemotherapy drug causes inflammation and injury to those nerves, which we'll talk a little bit more about later. It impacts 30 to 68% of people within 30 days of completing chemotherapy. It can impact some patients almost immediately. 30% of those patients that are impacted with chemotherapy may continue to have symptoms 6 months into years later. And we'll talk about why and what you need to know about that. So what might be some of the risk factors and why might you have more symptoms than perhaps the person next to you? There's what we call predisposition, or things that have happened in your lifetime that may impact the chemotherapy. One of them is increased age. The chemo dosage itself, how often you're getting chemo, how strong the chemotherapy is based on your particular cancer diagnosis. The mix of, we call the drugs that they give you for chemotherapy a cocktail. And there's sometimes there's multiple drugs within that cocktail, some being more neurotoxic or more damaging to the nerves than others. The physical activity that you had prior to being diagnosed, and then any other pre-existing conditions. Some of the pre-existing conditions or conditions that you had prior to having cancer might be diabetes. It might be HIV. We know that alcohol use, high alcohol use, can impact peripheral neuropathy and kidney disease. So where do the symptoms start? Peripheral neuropathy is going to be hands or feet. It's not one hand, it's not one foot, but it's both. So we call it the stocking glove appearance. So you'll see in my photo here that it's the feet and the hands, and it can travel upward. It usually starts at your fingertips or your toes, and it can travel upward. You don't necessarily have to have the hands and the feet together. Some people just have it in their hands, some people just have it in their feet, and then there are also patients who have it in both. So what are the types of symptoms that you see? In some people, it's a sensory thing. So they either lose feeling in those areas, or they're so hypersensitive that they can't be touched. Some patients report it, and the evidence shows that it impacts motor, which means walking, grabbing, and doing those kinds of things. It starts after you start chemotherapy. And again, how long it lasts depends on the dosage, the length of time, and the particular cocktail. So this just talks a little bit about the types of chemo drugs, and this will talk a little bit about the classes. Now, depending on the type of cancer that you were diagnosed with will depend on what type of chemo drug they use. Your taxanes, which are over here, your Taxol, your Taxoteres, those are often used with breast cancer patients in other different populations. Those, if you were on a taxane or a Taxol, Taxotere, you could have symptoms 24 hours after your first infusion. And those symptoms can progress throughout the treatment. Your Vinca alkaloids, those drugs are more for like your blood cancers, your leukemias, your neuroblastomas. Those drugs are can impact, you might feel lightheaded, you might have constipation, you don't know where your feet are in space. Your platinum drugs are also used with your chemotherapy, sometimes with your prostate cancers. Those are anything that ends in platinum. And those often cause real hypersensitivity. So what that means is that anything cold is going to be a real problem. Touching cold, sometimes even drinking cold drinks can be a problem for patients with this type of drug. Your protease inhibitors, those drugs too can they can either be hypersensitive or hyposensitive, and we're going to talk a little bit more about that. And then the combinations. So what are some of the sensory symptoms that people experience? They have that numbness and tingling in their feet, in their hands and their fingertips, or in their feet. They often say it's like pins and needles. Patients report it as feeling like their socks are always bunched up. When you go to bed at night, if the sheets hit the top of your feet, it can be really, really painful. You're super sensitive to cold. Like I said earlier, even drinking something cold can cause the symptoms to increase. You'll oftentimes have difficulty with fine motor coordination if it is in your fingertips, buttoning shirts, writing, holding on to instruments, cooking utensils, anything like that that requires you to hold with your hands can really be a problem. The symptoms can start early, like I had mentioned earlier, depending on the chemo drug that you're on. Some of the symptoms can start within 24 hours after the infusion. The symptoms may increase with each individual dose, which is what we call cumulative, and they can continue through and often be with you well after you've stopped the chemotherapy. It's the tingling in the fingers and toes, and it all depends on the type of drug the types of drugs that you have. The coasting effect is an effect that happens a lot of times. Patients, they'll finish chemotherapy and they'll say, well, I'm all done with chemotherapy, but I still have symptoms. That's what we call a coasting effect. And those symptoms after chemo, they could continue to increase until they reach a plateau. And that can go on for months after you finished chemotherapy. In some cases, that once they reach the plateau, they start to lessen again. In other cases, unfortunately, they don't. And so those are the patients that are years later that still have those symptoms that the compensatory strategies are really help. So what happens when it affects your motor? You have weakness in your hands and your feet. So reaching into the cupboard to pull out a mug to get coffee can be a real problem. You lose strength in your hands. So opening things with the opening cans can be a problem. Opening bottles, water bottles. The weakness occurs with your feet as well. And so knowing where you are in space as you walk can be a problem. Patients describe muscle cramping. Sometimes the hands and the feet just cramp up. That's very common. We have what we call foot shuffling. Because the nerve endings in your feet have been impacted, a lot of patients have what we describe as a foot drop. So they're not able to control their ankles the way they used to, and the foot kind of drops downward, and they have a tendency to shuffle when they walk. It affects what we call your proprioception. And proprioception is a fancy word for saying where you are in space. So it's something that we take for granted. We know where our feet are and when we're walking. But when we have peripheral neuropathy, because we don't have the nerve endings in our feet, when we put our foot down, we're not quite sure where we have put our foot down. And oftentimes we think we're putting our foot down flat, but we're not. And so this really increases your risk of a fall. Patients will do a lot of furniture walking. So if you're a caregiver that's on this lecture today and you see your loved one holding onto furniture as they walk, ask them, do you have numbness and tingling in your feet? Is there something going on with your feet? Because you sense that your balance isn't right. So you hold on to things as you walk. We talked about the increased risk of falls. Sometimes the symptoms will start and they'll be very minor and then they progress. And so that's when that's when we need to start thinking about compensatory strategies, making some changes within our environment. And we talked a little bit about the coasting effect, and that coasting effect, you can continue to get symptoms, and the symptoms can progress for like 2 to 5 months, and then you'll hit your plateau. But again, sometimes patients, when they hit the plateau, they don't come back down again. One of the drugs that we had talked about earlier can impact what we call your autonomic nervous system, which is your involuntary nervous system. And that may people report slower heart rate, they're lightheaded, they may have urinary dysfunction and constipation. These are the drugs that they use for patients who have blood cancers and neuroblastomas. So we talked about those sensory symptoms. So we're monitoring pain. That pain that we feel in our fingertips, it's going to impact our ability to do everyday activities. We might not be able to open that water bottle any longer. Emptying the dishwasher, we might find that, we're dropping things as we go to empty the dishwasher. We can't put our earrings in anymore. When we hold the razor to shave our face, we can't get a good grip on it. So it really is impacting our ability to do our ADLs and our IADLs, and it's impacting our quality of life. So what do? We want you to inform your oncologist if you're feeling this, if you're feeling any of these symptoms. There are things that there's things that the physicians can give you to help with the pain and the symptoms. But I can't emphasize enough, it's really important to let the people down in the chemo suite know that you're experiencing these symptoms. peripheral neuropathy is the #1 reason that people stop chemotherapy. So the chemotherapy is life-saving. It's getting rid of your disease, but it's really important that you let your oncologist and your chemotherapy team know that you have the symptoms, because they can switch your cocktail up. They can make some changes. It's not an all or nothing. So you want to let them know so that they can make whatever changes they need to get you through, so that you can finish the protocol that they've set for you. So where does OT come into play with this? Occupational therapy. We assess grip strength of your hands. The occupational therapy team typically works with the hands, and the physical therapy team typically works with the feet. There is some crossover and we both do both, but that's kind of typically what happens. So we're going to test your fingers. We're going to see if you are what we call hypersensitive, which means you can't stand any touch at all, or you're hyposensitive and you don't recognize cold and heat. So we assess that. We're going to assess your strength. We're going to measure grip strength, and we can give you exercises to help you improve that strength so that you can start using your hands again. We work with fine motor coordination so that we want you to be able to do those fine motor tasks. We want you to be able to tolerate a pen so you can write, and be able to put your earrings in and shave your face, change the oil in your car, do all those things. Oftentimes we will strengthen, but then we might recommend some adaptive equipment. We might say that it would be good for you to use what we call a gripper to take the cap off the water bottle. There's all sorts of really neat adaptive equipment that OTs are aware of that we can recommend to help you do the tasks if you're one of those survivors whose symptoms continue to linger. And we're going to provide you with some strategies to help make things a little bit easier for you, so you can improve your quality of life and get back to all those things that you love to do, whether it's painting or beading or working on your car. So the physical therapy team, they're going to assess your balance, your strength, and they're going to make sure that when you're walking, you're safe. They're also going to educate you on adaptive footwear. Sometimes you need to have orthotics that will help if you have that foot drop that we talked about a little bit earlier. There may be some equipment that you may need. If you're not safe, we may need to go to a cane. We may need to go to a rollator. So those are the kinds of things that they're going to assess. They're going to help you recognize what is unsafe and help you return to your physical activities. Always have exercise programs for you. They also do a lot of deep pressure massage, because even though they're going to assess you for being hyper or hyposensitive as well, and then they're going to do the same type of deep pressure massage that we would do on the occupational therapy side. And that's going to be your sensory treatment for your hyper or your hypo. So we know that exercise is protective, and it helps protect the nerves, even when we started early. So doing physical activity, even while you're on chemotherapy, is going to help protect your nerves, and it's safe. Structured exercise programs help reduce the symptoms of peripheral neuropathy. So we want you to be taking those walks. We want you to be doing your gardening. We just want you to be doing it safely. We know that the most effective type of exercise is one that includes strength and balance training, as well as endurance, which is going to be your walking. But we want you to be able to do it safely, and we're going to talk about that in a minute. So this is an interesting scale, and it's a scale that I encourage you, you can Google it. It's called a Borg scale, a BORG. And what it does is it measures your endurance. So a lot of us have those fancy watches that, check our heart rate and it tells us what we should be doing. But this is a scale that really measures how you are feeling. So this is very much about you. It was created from the American College of Sports Medicine. And we know that during the first 3 to 6 months after you finish treatment, that you should be working in what we call the fairly light, which is going to be your 11 to 12 range on this scale. So how do we know? How do we measure that? The way we do it is that we start to walk, and this can be used to cross a parking lot. It can be used when you're emptying a dishwasher, when you're washing your car, when you're playing with your grandchildren. You want to think about how you're breathing. So when you start to walk across the parking lot to go into a grocery store, if you're able to walk across the parking lot at a fairly good pace and you can talk without going like this to catch your breath, then you're working fairly lightly. And that's where we want you to be. If you're walking across that same parking lot and I say to you, I want you to sing happy birthday, and you start to sing happy birthday and you can't, then you need to slow your pace down. You should be able to walk and talk, but not sing and walk. So when you're doing activities, think about this. If you're vacuuming in the house, kind of like talk to yourself a little bit. Do you feel winded? Do you feel yourself gasping for breath or going like this? If you are, then you need to slow your pace down a little bit because you're working too hard. If you're doing that and you're not feeling that at all and you're able to talk, you might be able to work a little harder. And this is something that you kind of want to bear in mind. The thing to think about is if you're outside and you're walking, remember those hills and those inclines. Those are going to impact how you're feeling. So measure yourself. And if you feel like you're struggling, then you need to slow the pace down or take a break before you try to climb that hill. So we're going to talk a little bit about footwear. Footwear is important when you have peripheral neuropathy in your feet. A lot of patients report that they like a stiff shoe, a shoe that is not really cushiony. We all love those Skechers that have that Tempur-Pedic feel that kind of gives that gives underneath our feet. But with people with neuropathy, they don't really like those quite as much because it's hard for them to feel where their feet are on those shoes because the padding moves with them. So you have to find what's best for you, but most patients prefer to have a stiffer sole on their shoes. And this is where your physical therapy team will come in. They can make some recommendations based on how you're walking. You can also speak to your doctor. You want to have a toe box. And by toe box, I mean, it's the area of the shoe where your toes are. If you keep your toes spread out a little bit, it allows you to feel where each of your toes are within the shoe, and it helps with the gait. And it also helps with balance. So as much as we all love these shoes over here on each side, a flat shoe is going to be better for you. It's going to help you know where you are in space, and a tie shoe is going to always be our recommendation. So we talked about the Borg scale, and I do want to reiterate that it is important to understand your heart rate, and you can do that by taking your pulse. We're going to use the Borg and the pulse, and we want to keep your exercises with low intensity. We don't want you trying to run a marathon. We don't want you trying to race across the parking lot with your friend or your significant other. It's always like a slow and steady pace. If you're doing exercises with resistance, either resistance bands or you're doing things with weights, we want to keep the resistance or the weights low, and we want to do more repetitions. So rather than pick up a black TheraBand or a 10-pound weight, we might go with the 5-pound weight. And instead of doing one set of 10, we might do 3 sets of 5. So we want to keep the reps lower and we want to do more sets. We also want to focus on one muscle group at a time versus multiple. So we don't want to be doing bicep curls with squats at the same time. We want to focus on the arms, then we focus on the legs. So we also want to keep you safe, and this is the most important part of this. Oven mitts. I know I can only speak for myself, but I have a tendency to always say, oh, I only need one oven mitt because I'm right-handed. I'm going to reach in with my right hand and pull the pizza pan out. Wrong. We should always have 2. And the reason being is that if we reach in with that dominant hand to pull it out and we lose our grip, instinctually, you're going to reach in with your left hand to help, and you're going to get a burn. With peripheral neuropathy, you're not going to, you have that sensation issue with your fingertips. So always, always 2 oven mitts. When you are turning on the water, it is our recommendation that you start with the cold water and then you slowly add the warm water so that you can get the temperature the way that you want. Because with some neuropathies, you're not going to be able to feel that heat as quickly as you should, and you'll be at risk of a burn. And when you're doing anything in the yard or household tasks, we always want you to have gloves. Gardening, when you're working on household tasks, always have gloves on both hands. As far as things, daily activities in your home, as much as we love the scruffy slippers, they're easy to slide our feet into so that we can do some quick things. With neuropathy, it's a big no. It increases your risk of falls. So none of those slide slippers. We want you to have your foot in a slipper, preferably with a sole on them. So again, you can feel where you are, where your feet are in space. If you're feeling lightheaded when you go from a sitting to a standing, try pumping your ankles, doing a couple of ankle pumps before you rise up off of the chair, and rise slowly. We all have a tendency to want to get where we're going really quickly. Our body needs to have that couple of seconds for everything to recenter. So come to a stand, and before you start moving, count to 2. 1, 2. Now move. If we start moving before our body gets acclimated to the fact that we've stood, it puts us at risk of fall. So some home modifications that you might want to make. As much as we love these scatter rugs around our toilet and in our bathrooms, they are an area of very high risk. Think about it. The bathroom is where we go. The bathroom is a place where if we're sleeping and we have to use the toilet, we're going at night. The lighting is not as good. We're waking up from a sleep. We're not as cognizant of where we are. Those rugs are a hazard. They're a fall hazard. So it is our recommendation that you remove scatter rugs. When you have neuropathy, especially in your feet, you oftentimes don't know where your feet are in space, and it's easy to miss that curb when you're outside walking. It's easy to miss the changes in the environment. Rugs, and especially those baker's mats where we stand in front of the sinks and in front of the stoves that feel really good under our legs. Those are especially those are a special problem because they don't move. These scatter rugs, they move, which is a problem unto itself. But the baker's ones that do not move, they're not going to slide with you and that you're going to tumble forward. So as much as we love them, we recommend that you not use them. The water heaters, set your water heater temperature down a little bit to reduce risks of burns. And add night lights. I can't speak enough about the night lights. When we wake up from a dead sleep because we have to use the toilet, we're all confuzzled. We don't know where we are in space, where we're kind of fumbling through. We need night lights to shine the path so we can get to the bathroom without any fall risks. We'd like to see you doing skin checks. So we want you to look at the bottoms of your feet. You should never be walking barefoot. And I didn't mention that to you earlier, but you should never be walking barefoot because you're not going to feel some of the things that could be a hazard to you, to your feet. You want to inspect your feet for cuts and cracks and scrapes. The same with your hands. You want to be looking at your fingertips, monitoring your skin. If you have any cuts or scrapes or anything, you want to treat them with whatever your favorite antiseptics are and antibacterials, you want to use those. Apply a dressing, you want to monitor them. You want to make sure that that cut is healing. If it's not, then you want to bring it to the attention of your physician. Remember, no bare feet and always have gloves on when you're working and those oven mitts. So what are some of the things that we do in therapy to help with that hyper or hyposensitivity? When people are hypersensitive, that means that they have a poor tolerance to touch. So when they go to grab that pen, they get that pins and needles. That it's just a horrible feeling. So what we want to do is we want to retrain your nervous system at the fingertips and in the toes. And we do that with deep pressure. So you can do some deep pressure massages. You can do it with or without lotion. You want to desensitize with a rough towel, that rubbing back and forth. And again, just picking up a towel for some patients is going to be extremely painful. So you're going to start slow and build up tolerance to these things. The same with your toes. You know, you're going to start maybe with a towel, doing like toe curls with the towel and build up. We use what we call a mini handheld massager, which is this little gadget right here. It runs on batteries. That vibration feels really good to some patients. And after using that vibration, they're then able to, so when you do all of these desensitization techniques, that's when you want to go do that fine motor task. So if you're going to put on a shirt that requires buttoning, if you do some deep pressure on your fingertips before you go to do those buttons, it's going to be easier for you to feel those buttons. You're going to be able to tolerate moving the buttons through the hole a little bit better. And then the last one there is rice. And what we do with rice is we put it in a bowl or like a long Tupperware container. And just moving the rice through your fingertips is helping to desensitize that sensation, that pins and needles that you feel. As you get better with that, and as you do those rice sensory things, you can then add in some coins and some beads, and without looking, you can try to find them. Think about reaching into your handbag and trying to find that coin. When you have peripheral neuropathy, it's very difficult to do that because you can't feel the edges of the coin. So this is an activity that we do a lot in therapy. And then we advance it, and you'll notice in the picture, they now have like tongs. And that's getting this, once you get the grip strength back, you're using the tongs to help you lift those pieces out. So it's a multi-used type of tool. So for those that are extremely hypersensitive, that's when you're going to have to really start slow with the sensory. Those are the people that can't tolerate the sheet on their toes at all. So remember, it's slow. It's whatever you can tolerate as often as you can tolerate. I always tell my patients, keep that towel near where you sit watching TV, and just gently rub your fingertips on that towel. If you and always be able to do it before you have a task that requires fine motor skills. So now I'm going to open it up to Q&A. If anybody has any questions, I want to thank you for listening to me today, and I hope that the presentation has been helpful to you. So I'm going to stop the share, and I can answer, hopefully I can answer any questions you have.